right?
Yeah, actually, like listening to his story, I actually got goosebumps thinking about that. It took 12 years, 23-year-old person, 23-year-old man. He had headache. He had 180 by 100 blood pressure, evaluated by cardiologists. Cardiologists, see, they have a lot of busy practice, and hypertensive patients mostly reach cardiologists. So he had potassium of 3,
Mhm.
and but sadly no effort to evaluate his underlying cause was made. Next slide, please.
Yeah,
This story
that is the thing. So he had gone to a specialist.
Yeah, story is very interesting because he remained off medication for 7 years, although he continued having headache.
Mhm.
So it might be like silent disease at times. No symptoms are there. Then he continued to have occasional headache. Then after 7 years, he had episode of epistaxis for which he sought help, and blood pressure was 200 by 130 at that time. Then again, he had a potassium of 2.43. Again, he was not worked up. And it's so interesting that how he was finally diagnosed that he had pain abdomen for which somebody did CT scan. And at
Oh,
that time, he was diagnosed to have right adrenal adenoma. And then retrospectively, then everything was correlated. All his reports, when we asked him to bring all his report, then we found that all his reports were showing hypokalemia. Unfortunately, he could not be cured of his hypertension, but drug they were dramatically reduced. So
mhm.
it can cause permanent kidney damage. You can see he's had all these. He had LVH, left ventricular hypertrophy, on echo. He started having CKD, and he also had hypertensive retinopathy. So he developed all these
All the
complications.
end organ damages. So his
Yeah,
kidneys
yeah,
were damaged, his heart was damaged, his uh,
everything.
eyes, his vision was damaged. All this because of number one, of course, for 7 years he remained off of medications despite having hypertension. And
That is
more importantly, the primary aldosteronism was not diagnosed. And Dr. Alam, this is very interesting. So pain abdomen normally wouldn't really require a CT scan.
That's what actually some many you would just see this. They even in fact patients are aware of the CT and MRI, so they would themselves ask that okay, now please order an MRI. It's very common in our setting. One patient, you won't believe that one patient told me she came with some problem of I think a short stature, and I ordered some tests. So he said no, we don't want these tests. We want a whole body MRI so that anything can be diagnosed. So patients are having awareness about like radiological investigations,
Mhm.
that they themselves are asking for it. But in terms of these, I mean, maybe after our session, people will ask for this test that doctor, please, can you order one test for primary aldosteronism for me? Then the doctors will have to go and look at like, okay, the patient is asking for it. I might as well read about it. So that would
Yeah.
can be learning both ways.
And
I mean,
so, Dr. Alam, that is one of the things I want to highlight. What can patients and what can, of course, doctors do? And you've already, highlighted so much of the cardiovascular disease. But the other big thing is the treatment changes, and that is so important because it's not like just doing more expensive investigation to find out something and then there's nothing left to do. It's not really that. So I'm just quickly going through these slides because you've already discussed these things before. So here you're talking about mineralocorticoid receptor antagonists. So will you name some of the medications available in India and where, what could, let us say now here, this is a problem for doctors, not so much for patients, that they are treating a patient with hypertension. So where would they look at mineralocorticoid receptor antagonists and what are the ones available in India?
see, in India, spironolactone is the most commonly available, but one very big problem, especially for males, is like they have gynecomastia. They develop gynecomastia after taking that, and it blocks testosterone levels as well. So we cannot empirically start, especially in young patients. But
Mhm.
eplerenone is a specific antagonist. It is also available, although slightly costlier than that. But if patients fit into the profile of even like they don't have any specific adenoma on CT scan, but they are fitting into low renin hypertension, they can definitely benefit from eplerenone.
Okay, so spironolactone is the medication which has been, which is actually, Dr. Alam, older than you. I think it's about 50 years old. So spironolactone, again, as Dr. Alam mentioned, she mentioned a term called gynecomastia, which means essentially man boobs. So men developing breast, increase in breast size, because it antagonizes testosterone. So testosterone levels lower. And in fact, spironolactone is used in PCOS women to reduce testosterone levels. And interestingly, a lot of PCOS women have hypertension as well. So it has been used for hypertension and PCOS management together. But the other one, now will you spell out the other one? Epi, what is that?
It's eplerenone. I'll just spell out.
Anyway, we'll add the name to the to our YouTube video description. So again, these are specialists. Specialists would be aware, endocrinologists would be aware of these. We can just Google also. So it would make a huge difference in the treatment. Now, this is the other important point, because many people think, oh, her blood pressures are normal, or his blood pressure is normal on the existing treatment. Why do I need to find out more trouble, when my primary goal is managing hypertension, right? But this one, again, you have repeatedly stressed upon all the other problems rather than just looking at blood pressure only as one of the biomarkers.
I would like to add one thing in the previous slide, that it's not just, even in those who are getting mineralocorticoid receptor antagonists, that it's important to check the renin levels, that we are actually antagonizing properly or not, that renin should rise. In fact, there's a beautiful paper published in Lancet which showed that in patients who were on mineralocorticoid receptor antagonists, patients with primary aldosteronism, those who had raised renin, they have long-term beneficial effect in terms of mortality.
Oh, okay.
So